Welcome to the Western Ohio PBIS Network podcast. My name is Brandy Stiegel. You are watching video one of the 7-part video series that will focus on building your Tier 2 PBIS framework. By the end of this video, you will understand the key features of school-wide PBIS Tier 2 systems and the characteristics of effective interventions. You will understand the basic concepts and processes associated with intensifying supports for students who require additional intervention. You will understand how to identify group-based interventions that may be appropriate and will meet the needs of staff and students. You will be able to determine your readiness for your Tier 2 PBIS framework against the recommended criteria. Data from the World Health Organization, or also known as WHO, indicates that mental health challenges affect approximately 450 million people worldwide. Roughly one person out of every four will develop a mental or behavioral health challenge within their lifetime. Individuals who experience these conditions are at a greater risk for a number of social and economic challenges that include reduced access to healthcare, reduced access to social services, reduced access to emergency relief, as well as reduced access to educational opportunities. They also face restricted employment and income. They face the stigma of mental health. They face potential discrimination, violence, abuse, and an increased risk for further disability and premature death. Given the prevalence rates of mental health disorders among adult populations, it is not surprising that large numbers of children and youth are also affected by social, emotional, and/or behavioral health challenges. Surveys conducted in the United States have indicated approximately 1 in every 3 or 4 children experience disorders, and 1 in 10 is identified with a serious emotional disturbance to the extent that functioning is impaired. Left untreated, these challenges may increase in intensity and severity, resulting with persistent negative outcomes as children and youth emerge into adulthood. Data was collected from a nationally representative sample of more than 10,000 youth ages 13 to 18 years of age and their parents. Results showed that 31.9% were diagnosed with an anxiety disorder, 19.1% were diagnosed with a behavioral disorder, and 14.3% were diagnosed with mood disorders. Roughly 40% of the respondents met criteria for more than one disorder. In addition, the median age of onset occurred differently according to the disorder. Anxiety disorders began emerging at 6 years of age, as well as behavioral disorders began and onset at 11 years of age. Mood disorders began at 13 years of age, and substance use disorders were found to begin at about 15 years of age. Among preschool and young school age children, symptoms that emerge prior to diagnosis of disorder are often described using the broader terms of internalizing or emotional behaviors and externalizing or behavioral problems. Evidence has indicated internalizing and externalizing problems are commonly experienced during early childhood. As many as 15% of children ages 18 months to 5 years of age, and approximately 1 in 7 school age children are affected. Effective intervention can reduce the risk and intensity of impact of these behaviors, but many children and youth who experience mild to severe problems, either internalizing or externalizing, are often inadequately supported, delayed in accessing services, or receive no treatment at all. For the few children who do receive social, emotional, and/or behavioral supports, schools are typically the primary provider of those supports. In fact, schools play an essential role in the lives of children and offer a natural context for access to and delivery of preventative and early intervention services. Implementing a PBIS framework can ensure that children who need additional support are identified and have access to effective instruction and intervention. As we previously have talked about, 4 elements guide the systematic implementation of PBIS. Those 4 elements are outcomes, systems, practices, and data. Outcomes refer to the impact and the result of school-wide PBIS implementation that is implemented with fidelity, consistency, and equity. Systems are those deliberate supports for adults that are put into place to ensure the accurate implementation of practices over time and that they can endure over time. PBIS is based on a multi-tier systems of support. It is the companion to your academic systems. As we know, that universal interventions support 80 to 90% of students in all settings. They are preventative and they are proactive. Tier 2 systems are targeted group interventions, support 5 to 15% of the students. These are going to support those students who are found to be at risk. They provide those small group interventions to teach those behavioral and social skills. Tier 3 systems or Tier 3 PBIS systems, just like within Tier 3 academic systems, they support 1 to 5% of students who need intensive individual interventions. Just to go back over, PBIS is based on 8 essential components. One, understanding a common philosophy and purpose, meaning we have a shared vision and understanding of what our expectations are in the building. We have a leadership team that focuses on driving those decisions using data, clarifying expected behaviors, teaching expected behaviors, encouraging expected behaviors, discouraging inappropriate behaviors, ongoing monitoring using data, as well as incorporating research based effective classroom practices. The three-tier prevention logic organizes behavior supports along a continuum, matching intensity to student needs. The tier 2 data practices and systems are designed to use data to identify students who are at risk or currently experiencing emotional and or behavioral difficulties. Tier 2 systems are designed to prevent the development or decrease the frequency and or intensity of student behavior problems, as well as tier 2 systems are designed to provide standardized interventions that effectively and efficiently support students, yet do not require the time and resources needed to develop individualized plans. The purpose of Tier 2 is to provide interventions to support up to 15% of the student population who are at risk but not currently engaging in severe problem behavior. It is to decrease the development of new problem behavior. Tier 2 is designed to prevent worsening and reduce intensity of existing problem behavior. It is designed to eliminate triggers and maintainers of problem behavior, as well as add triggers and maintainers of pro-social positive behavior, as well as teach, monitor, and acknowledge pro-social behaviors. Tier 2 interventions are often provided in group-based format, which include standardized practices and systems designed to supplement primary prevention efforts or your Tier 1 universal supports. They are appropriate for students who exhibit problem behaviors across multiple settings. The Office of Education, Special Education Programs, also called OSEP, indicates Tier 2 interventions have the following characteristics. They are continuously available, meaning that Tier 2 support should be available in the school such that students can be added to the interventions at any time. Some interventions are organized so that students can begin receiving support quickly. Tier 2 interventions are quickly and easily accessible, meaning that optimally these supports are accessible within 2 to 3 days when data reveals a student needs these supports. Some intervention approaches require more formal interviewing, selection of additional participants, and may not be possible to add students to these programs that quickly. However, the initial steps to provide a student with a Tier 2 intervention should begin within 72 hours of identifying the need for Tier 2 interventions. Tier 2 interventions should require minimal time commitment from classroom teachers. Some Tier 2 interventions may require classroom teachers to modify traditional methods or implement new teaching strategies. For instance, increase positive feedback, monitor students' progress, and evaluating behavioral and academic progress. Ideally, Tier 2 interventions will fit within the existing classroom routines. They should require minimal changes to methods and strategies and require only a few more minutes of a teacher's time each day. Another characteristic of Tier 2 programs is that they require skill sets can be easily learned. The skill sets classroom teachers need are consistent with quality instruction and can be easily learned. Strategies that require intensive training and skill development, not typically present in the repertoire of classroom teachers, may be beyond the scope of Tier 2 interventions and may be considered as intensive and individualized for Tier 3 interventions. A quality Tier 2 program should be aligned with school-wide expectations. Tier 2 interventions should be consistent with the Tier 1 approaches the school developed. School-wide expectations should be taught and applied consistently across all three tiers for greater consistency in implementation. Quality Tier 2 programs also mean that all personnel are aware of the interventions and their role in the process. All staff should understand the rationale and be able to describe the Tier 2 interventions used in their school. Staff with responsibility for implementation should have training, skills, and administrative support to implement Tier 2 interventions with fidelity. Tier 2 programs interventions should be consistently implemented with most students, but with some flexibility. Tier 2 interventions may be implemented similarly for 90% or more of the students receiving the intervention. Minor modifications may be made to increase the effectiveness of the intervention. However, significant modifications of Tier 2 interventions for a student may be more characteristics of a Tier 3 individualized support system. Tier 2 intervention programs select interventions that are matched to the student's function of the behavior. So quality programs are going to match those interventions with the functions of those students' behaviors. Although it is not recommended that a comprehensive functional behavioral assessment or FBA be completed for each student identified for Tier 2, it may be, because that may be too time consuming, it is necessary to consider the function of the problem behaviors using already existing data, such as discipline referrals, brief teacher ratings, or an interview. As the data reveals that a student is responding poorly or questionably to intervention, the function of the behavior may need to be assessed with more comprehensive methods, and implementation fidelity should be verified. A variety of research-based interventions meet the criteria, and most incorporate effective practices such as targeted and explicit instruction, acknowledgement of appropriate behavior, increased consistency, structure and routine, performance feedback for targeted behaviors, and carefully orchestrated plans for generalization and maintenance of skills. Some commonly implemented small group oriented interventions include check in and check out, which is also known as the behavior education program, social skills intervention groups, self monitoring, the check and connect student engagement model, the first step next, targeted interventions such as positive peer reporting, tutoring, class-wide function-related intervention teams, and simple functional behavior assessment. Another commonly used Tier 2 intervention is academic instructional groups, as well as academic accommodations. School-wide PBIS should be aligned with the school's mental health program. Implementing comprehensive school mental health services can help develop a proactive preventative system that fosters positive school climates and that is focused on teaching and learning. The school-wide PBIS framework cannot assume the responsibility of being the only component within its comprehensive school mental health support model. However, implementation with fidelity of the school-wide PBIS framework can help strengthen and support a comprehensive school mental health support model. So when thinking of determining the needs for a PBI for Tier 2, you want to follow somewhat of a flowchart. So the first question we want to ask is if the Tier 1 practices or those universal supports are being implemented with fidelity. If the answer is no, then we need to go back and revisit our Tier 1 program to ensure that we are implementing those practices with fidelity across all settings amongst all staff. If they are being implemented with fidelity, then the next thing we're going to do is to determine how we are going to identify students for Tier 2 services. That could be through a teacher or parent nomination. That could be through the use of existing school data, such as office discipline referrals, classroom records of discipline, or whatever method you're using to collect discipline data. You can also use a universal screening instrument, which we'll talk about in later videos. After the team has determined those students that need to have tier two services, then the team is going to synthesize that data. They are going to look at those students that have been identified. They are going to define the problems and identify those replacement behaviors. They're going to look at the function of the behavior to determine the need or the intervention that is going to be matched with that behavior. So, for instance, if the function of the behavior is to obtain something, then we may use a check in and check out. If it is to escape and avoid tasks, we may use academic supports or some type of social skills intervention group. If it's to escape and avoid attention, we may use self monitoring. The key is that we want to be sure that the intervention matches the function of that behavior. So, early intervention is the goal for all students. Tier 1 universal practices will be enough to support approximately 80% of the students in your school. This is the most efficient system of support, requiring minimal adult resources per student. Tier 2 interventions are designed to proactively identify students at risk for developing problem behavior or just beginning to exhibit problem behaviors. When student identification is done effectively, you can estimate serving 10 to 15% of the school's student population over the course of the year in Tier 2 interventions. Tier 2 interventions require more adult involvement for fewer students, yet they efficiently produce effective results when the interventions are delivered with fidelity. Students who are already exhibiting chronic behavior problems may require Tier 3 interventions. If Tier 1 and Tier 2 are being implemented in the school setting with fidelity, a school may need to provide Tier 3 interventions for approximately 1 to 5% of students in the school. Tier 3 systems require the highest staff to student ratio and can be very labor intensive. Once the school leadership team has identified the projected needs based on school enrollment, then the teams can begin thinking about schools' capacity to provide support across the tiers. Using existing school-wide data such as attendance rates, percentages of students with 0 to 1 office discipline referrals, assessment data, grades, and other collected information, the leadership team can determine the current overall response to the Tier 1 universal system. The leadership team will then have the information to compare the school's base rate or the proportion of students in the school who exhibit emotional or behavioral risks to the expected base rates in the tiered intervention model, which is 80% of students should be supported by Tier 1, 15% by Tier 2, and 5% by Tier 3. Next, the team can calculate the serviceable base rate or the amount of students identified as at risk who could reasonably be serviced in a small group or individual intervention with the current resources available in the school. The school's current resources could include personnel, curriculum, materials, scheduling flexibility, team stability, and other factors supporting implementation of practices. When teams are prepared for implementation with the necessary information, they are more likely to be accurate in their decision to use universal screenings when effective supports are in place at Tier 1. And they adequately plan for the efficient and effective use of resources and accurately provide the needed level of support for students with screening when screening indicates those that are at risk. Using the information about the current base rate and the calculated serviceable rate allows the school team to determine whether the time is right to consider adding the systemic screening process or if a focus on intensifying the universal supports is more appropriate and a better use of resources. It is inefficient and unlikely to be sustainable for schools to serve 30 to 40% or more of their students in intervention or targeted interventions or individualized interventions. Schools can still use information from screening instruments in the planning and provision of robust universal supports, but should keep in mind the information about their serviceable base rates. When the data from the universal screening instrument has been collected and analyzed, schools can plan for the appropriate response. Using the information about the school's projected capacity and serviceable base rate, the leadership team can identify how school-wide, class-wide, and individual supports can be provided. So in our first scenario, we're looking at when school-based rate is greater than or equal to the serviceable base rate. If the screening results indicate the proportion of students exhibiting emotional or behavioral risk is higher than the previously calculated serviceable base rate, the team should focus on strengthening supports at the Tier 1 level. The leadership team needs to consider whether expectations and rules are taught and practiced sufficiently for students to perform them fluently and with performance feedback, whether all staff have had adequate training and feedback on implementation of Tier 1 supports and are implementing with fidelity, and whether the team is using data to monitor outcomes and responding accordingly to that data. In addition, the school may use the information to incorporate social emotional learning more prominently in their school-wide efforts, engage in ongoing professional learning about positive mental health and development, and focus their efforts more on specifically to those areas that they've identified based on the data. If the team sees that the school-wide base rate is less than the serviceable base rate, but classroom base rates are greater than the serviceable base rate, then the screening may indicate elevated risk rates are concentrated in particular classrooms or grade levels rather than distributed across the school. These things still represent more students than can practically be served in small group or individual settings. In this case, the leadership team will want to look more closely at the classrooms with elevated risk to determine whether intensified classroom support, such as increasing teaching, practicing, and feedback and following expectations, or specific social skills teaching, such as social skills intervention systems, class-wide intervention systems, or other research-based support is needed for that particular classroom. The leadership team could provide resources to intensify class-wide supports in these rooms, while considering referring students for the Tier 2 interventions in classrooms with base rates below the predetermined serviceable base rate. The third scenario is when school-wide base rates are less than serviceable base rates and classroom base rates are less than serviceable base rates. When the school-wide base rate and the classroom base rate are both less than the predetermined serviceable base rate, this indicates Tier 1 supports are effective for meeting the needs of the majority of the students, and then the team should consider small group and individualized interventions. Choices for small group interventions could include check in, check out, social skills intervention groups, self-monitoring, or other age-appropriate interventions. For students needing intensive individualized supports, schools should plan to conduct a functional behavior assessment in order to begin and to design an appropriate behavior intervention plan. As we have stated in all of our trainings, the instructional process begins with each student having access to, as well as opportunity to demonstrate mastery of a viable academic and behavioral curriculum which demonstrates rigor and relevance. This behavioral curriculum is what we consider your Tier 1 universal supports. Assessment data should be gathered on a regular basis and determine and review each student's response to instruction and the curriculum, your Tier 1 curriculum, in order to make an informed decision. Specific to behavioral and social skill instruction, all staff must implement universal elements with fidelity for all students. This means school-wide, non-classroom, and classroom expectations and rules, as well as procedures, are identified and taught. We are expecting that in order for students to have access to that behavioral curriculum, teachers must use those classroom practices that include teaching classroom expectations, teaching classroom procedures and routines, encouraging expected behavior, discouraging inappropriate behavior, providing active supervision, providing opportunities to respond, activity sequencing and choice, as well as task difficulties. So these are the 8 effective classroom practices that are evidence-based, that work within that Tier 1 system and that Tier 1 support framework to ensure that all students have access to those Tier 1 supports. So when we are thinking about implementing Tier 2, there are some consideration. All staff must implement Tier 1 behavioral curricula with fidelity. Effective classroom practices should be implemented to ensure engaging instruction in a well-organized classroom. Students should only be considered for additional intervention, i.e. Tier 2, after they have had adequate time to respond to Tier 1 strategies. This is approximately 6 to 8 weeks of those Tier 1 supports and intervention. Now, typically, students are not considered for additional intervention until they have had adequate time to respond to the Tier 1 strategies. Guidelines for deciding what levels of student support needs are going to vary from school to school. It is usually critical to confirm that Tier 1 and Tier 2 interventions are being implemented with fidelity. However, there may be instances when a student is experiencing very severe or significant academic problems or social emotional problems and may need Tier 3 interventions without having experienced a Tier 2 level intervention yet, or the Tier 2 intervention was not implemented for that long. Students receiving tier 1 and 2 supports that are not making adequate progress and are responsive to the continuum of strategies available may need those tier 3 services. Teams should have a system in place through which students who are experiencing very severe or significant academic, behavioral, or social emotional problems can access tier 3 support sooner than the time that has been defined within your tier 2 planning framework. So the tier 2 process follows this schedule. The first thing that the team is going to do is identify students who may need those tier 2 services. They're going to collect and review data. They're going to clarify the behavior problem and identify the function of those behavior problems. They're also going to consider academic needs, to consider if these that there is any academic skills deficit that may be the underlying reason for some of the behavior problems. They're going to select and provide intervention matched to the function of the student's behavior. And then they're going to monitor progress and use data to make those decisions as to the continuation of the program, how well the students are responding to those interventions. The first step, as I said, is identifying students. So teams are going to create a system to deliberately and purposely identify students who may require more intensive intervention. This intervention identification system should be created to promote early identification before problems develop to a level that requires more intensive intervention. Systems should be designed to identify students with internalizing or externalizing characteristics of difficulty. Identification systems should use existing school data, teacher nominations, and may use universal screening scores, which we'll talk about later on in the series. The next step is to collect and review data, clarify the problem, and then identify the function of the behavior. Intervention should be based on the function of behaviors. Students can use simple or informal functional behavioral assessments to identify the function of those behaviors. They can also use data sources such as office referrals, classroom minor infractions, absences, tardies, grades, achievement scores, grade point averages, or even things such as the frequency of nurse or counselor visits to kind of help guide them to understanding the function and clarify the problems that the child is having. Another thing to keep in mind is the academic interventions. A lot of times we see that behavioral issues coincide with academic issues. When data indicates students are having academic difficulty, such as low grade, poor assessment performance, missing assignments, or using problem behavior to avoid tasks such as putting their head down, refusal to work, engaging in problem behavior that results in removal from instruction, teams should consider an academic intervention in addition to a behavioral intervention. So, as we said before, you want to make sure that all behaviors are selected based on the function of behaviors. Some children may require and benefit from more than one intervention. Children who are experiencing both academic and social skills deficits will require instructional and behavioral treatments. Teams should determine capacity to provide selected treatments and then select which interventions to develop and implement. A minimum of at least one academic and one behavioral intervention is recommended for students addressing the needs of children who are identified. So when we look at it, check in and check out is usually matched with students whose function of behavior is to get adult attention. Social skills intervention groups are most effective for students whose function is to get adult attention, to get peer attention, to avoid adult attention, to avoid peer attention, to avoid tasks, or to access activities or tangibles. Self monitoring is good and effective for those children who are also or their function is also to get adult attention, to get peer attention, to avoid adult attention, avoid peer attention, avoid tasks, and get access to activities or tangibles. Check and connect is usually more effective with students whose function of that behavior is to avoid adult attention, avoid peer attention, or avoid task. And then first step next is really more effective when the function of the behavior is to get adult attention or get peer attention. We also, in the process, the Tier 2 framework process, are going to monitor progress and make data driven decisions. So, Tier 2 teams are going to determine a reasonable period of time on a case by case basis to determine and monitor that child's progress. The length of the intervention is going to depend on the nature of the problem, the nature and intensity of interventions, the frequency of progress monitoring, and the ability of the team to monitor that progress. The Tier 2 team should develop a system for collecting data to determine the student's response to the intervention. Before a team is going to go to this journey of rolling out and implementing a Tier 2 framework, the first thing they want to do is ensure that they are ready for Tier 2. So, Tier 1 systems and practices are critical foundations for effective implementation of Tier 2 systems and practices. So, before a team is going to embark on this process of Tier 2, they want to make sure they have a 70% or higher on the TFI, that they have an 80% higher on the self-assessment survey for school-wide, and 80% on the self-assessment survey for non-classroom areas, and 80% or higher on the self-assessment survey for classroom areas. They want to make sure that 80% or more of the students in the 0 to 1 office discipline referral range or within national range for school grade. So they want to make sure that 80% of the students are receiving less than one referral. They want to make sure that there's consistent use of school-wide data for making decision as evidenced by the monthly Big Five. They want to make sure systems are in place to collect classroom minor referrals. They want to make sure that the team too includes administrator crossover members, behavioral expertise, or they have a desire to develop those academic expertise needed for the Tier 2 team. They want to make sure that all effective classroom practices have been taught to all staff and that there is evidence that these are being used in the classroom. And they want to make sure that there is access to district level support. If there are any of these things in place, then the team wants to go back and revisit their Tier 1 practices and systems to ensure that they are being implemented with fidelity and that they are ready for Tier 2. Tier 2 cannot be successful if your Tier 1 program is not being implemented with fidelity. Thank you for watching this video. Please don't forget to hit like or subscribe.